everyone, it's NonnaGrace, and I'm from Western New York. Today I want to talk about something that could affect many of us, and especially as we get older, and it's called shingles. If you get the shingles, it's important to know how to handle the pain and what to expect. The varicella zoster virus is the one that caused chickenpox, and that stays dormant in your system. And when you are under stress, or if your immune system is lacking, that nasty virus can pop its bad head up again and cause you to have shingles. The first sign of shingles is usually an itching or tingling or burning effect. Mine was a stabbing effect in my eye. My left eye felt like there was something in it all day, and I had Laura look to see if she could find something, and she couldn't find anything. Jim couldn't find anything. I couldn't see anything, especially. I even used a magnifying glass to look, and I couldn't see anything in my eye, but it was like stabbing in the eye. I remember when I had shingles, it was a lot of pain. I didn't have the itchiness until after the shingles healed. They didn't itch while they were there. A lot of people will find that they itch while they've got the shingles, but mine were afterward. And like if I get cold, my head itches a lot. And right now, it feels like it's gone just a little bit on my eye up above here, and in my scalp a little bit. And this is where it itches my eyebrow used to bother me a lot, but it doesn't bother me anymore. And my eye used to bother me, and that doesn't bother me much. Unless I have the other glasses on. The other glasses, it sits in the area where I was getting the stabbing. It feels bad. So I wear these glasses. These are actually a little easier on my nose. The tricky part about shingles is that after the scabs and the blisters and the sores are all gone, you could still have pain. And the pain can be invisible. It's like having a headache that you don't feel, that someone else cannot see, but you can feel it, and it makes sleeping very difficult. Trying to lay your head on a pillow, well, mine, because it's on my head, I have to lay on my right side because my left side hurts. And the same thing if it was on your torso. A lot of times it can be on your torso. It can be on one side of your neck, or on one side of your rib cage and towards half of your back, but it only goes on half your body. It doesn't go on both sides. The after pain is called the postherpetic neuralgia, and I would just refer it to the PHN if I have to say it again, because it's hard to say the words. There's sometimes a burning pain, and I used aloe, the kind that you're supposed to use for sunburn. I used to put that on because it felt like somebody was holding a match there and just burning, and so I put some aloe on, and that relieved the pain. If you go to your doctor will give you a medicine for it. I went to the clinic?
You went to WellCare.
WellCare, yeah. I went to WellCare, and they prescribed 2 medicines for me. Forgot what they gave me. I have to go get it. One was a steroid.
And the other was Valtrex?
Yeah, Valtrex is what they gave me. Yes, you remember. Whoa, you're good. The PHN can last a few days, can last a few months, can last a few years. It can never go away on some people, and I feel bad for those people. That would be awful. Mine has gotten better. I feel like it's just in a few areas, and I take a little bit of ibuprofen, and I take a Benadryl to help the pain. And I was using a topical cream on it to help with it. I've actually been able to stop that. Nervive is the topical medicine that I was using. And I've been taking the B vitamins. I don't know whether this is helping or not, but the B vitamins, I've been taking all of them. I take B1, B6, the multi-B, or the booster B, whatever it's called.
Yeah.
I forgot what it was called.
I don't remember either.
And I take biotin, and I take an iron pill.
And B12.
And B12, yeah. And I was taking alpha lipoic acid too. I'm still taking that, and that's supposed to help the nerve endings. and the nerves have like a sheath that goes over them, and the sheath has been broken and the nerve is exposed. That's why it hurt. I got the shot after I had the shingles. Most people, when they get the shot, their arm will be very, very sore. The first shot especially, your arm is very sore. And the second shot, they've said that the arm is less sore. My second shot, I had only pain by pressing on it. My first shot, because I had had the shingles, it didn't even hurt. I was probably lucky in that sense.
Mm-hmm.
But you don't want it. If you ever get the shingles, you have to stay away from little kids that have not had the chicken pox, because they could get it like babies. They could, if they're not, even if they're too young for the shot, the shingles or the vaccine for the chicken pox, definitely want to stay away from them, because they could get it. And adults that have not had chicken pox, and if they were to get the chicken pox as an adult, they say it's very bad. If you're over 50, definitely get the shot. I have a graph that will show how your chances are of getting the shingles. As young, you're not as possible, but there are young people that have gotten the shingles that have had the chicken pox. My son-in-law had it at age 18, which is pretty old, and Jim's falling asleep because the heat is too much for him in here. We're done. Well, I hope you all had a great day, and I will see you in my next video. If you have any questions, just put them in the comments and I'll get back to you in case there's something I forgot. But have a great day, and I'll see you in the next video. Bye-bye.